and welcome. Yeah, I heard that you're here for a little bit of a medical checkup. Is that correct? Okay. I'm just gonna take some notes here to establish your baseline. Can you update me if anything significant has changed in your life or any kind of sudden symptoms of anything? Okay. Okay. And when exactly did that start? Sure. Yeah. Okay. And that has just continued until now, is that correct? Okay. Okay, I think I have a pretty good baseline of that. Do you have any issues with your sleep currently? Okay. And, roughly how many hours a night of sleep do you think that you're accumulating? Okay. I will have you know that quality sleep is very, very important to your overall health, okay? We definitely need to increase the level of sleep that you're getting. Any other concerns with any other symptoms or any other issues, obstacles, concerns, anything? Okay. And as far as your medication that you gave, intake and admin, are all of those up to date and correct? Okay. And you've been on those for over a year, is that correct? Okay, great. Great. Well, it seems like you are running a very good baseline. Yeah. Very, very consistent. Okay. Yeah, we might be remodeling the office pretty soon. We have this picture here, and I quite like it, but we might rearrange the room soon. So if you're ever back here, you might notice that things have kind of moved around a little bit, okay? But as for today and what we are here for, I'm just going to run a series of exams and tests on you just to establish a nice baseline with your health. And if we notice anything, we might refer you out to some type of other testing, okay? All right, great. So let's begin here. I like to keep things very sanitized here, so I do have some gloves here I'm going to put on, and just to make sure everything is sanitized and I'm taking care of you and myself. Okay, now that we have the gloves on, I'm going to get my stethoscope and just kind of listen to your heart and your lungs just to establish a nice baseline, okay? All right, great. Okay, let me just put my stethoscope in here, and then do you see this right here? So I'm going to move this around on your lungs here, and I just need you to take some breaths in for me, okay? So I do have to get a little bit closer for this. I apologize. So I need you to just deep inhale, please. Very good. And let's do another one right here, please. Very good. And one more. I'm gonna move the stethoscope end around to the back of you now, and we'll just do a very similar evaluation, okay? So let me just get this on the back of your lungs here, and if you could just take a deep inhale, please. Very good, and let's do the opposite side here, and deep inhale, please. Okay, very good. I am going to put this cuff on you real quick and just take your blood pressure. So just try to relax as much as possible here. You're going to feel some pressure, but it helps us evaluate your blood pressure here, okay? So just take a deep breath and try to relax here. Okay. Okay, everything seems to be great. Let me just check your oral health next, okay? Okay, your lungs sounded great, and your heart sounded healthy. It sounded very consistent. It gives us a great baseline. Now, I'm going to look around in your mouth here. I'm just going to need you to say, ah, stick out your tongue. I'm going to depress your tongue with this tongue depressor and just kind of look around your mouth, okay? So if you can just say, ah, please. Very good. Very good. And, yep, just hold there. You're doing great. Okay, your oral cavity seems very healthy and intact. If you don't mind, just to kind of bolster your oral health, I do have this medication here, and this medication goes under your tongue. So if you can open your mouth again, I'll slip the tongue depressor under your tongue and kind of pull it up, and then I will come in with the medication and give you a few drops just to keep your oral health really at a maximum level, okay? All right, so again, just say, ah, please. Okay, very good. And I'm just gonna work under your tongue and lift that up, and then let me get this medication open here. Could you just hold that there? Very good, okay. And just say, ah. I have to really make sure that your mouth has enough medication in it. Okay, and let me just release the tongue depressor. There we go. Great job. Let's move on to the next exam. Okay, just real quick, I want to just test some of your cranial nerves just to make sure that everything's on point. I have this object here, and this object spins. Now, what I'm going to need you to do is I'm going to spin this object, and I'm going to move the object from side to side. Now, I need you to keep your head still. Don't move your head at all. What I need you to do is simply move your eyes and follow this object wherever it goes, okay? Okay, great. Let's begin. So I'm just going to spin this here, and now just follow wherever it goes. Okay, let's try this again. I'm just going to spin this and just follow it wherever it goes. Remember, only follow it with your eyes. Do not follow it with your head and neck. Just follow it with your eyes. Let me do one more test here, okay? Just follow it with your eyes. let me make a note real quick about something. Okay, you seem to have a little bit of an issue with the cranial nerve exam. What we will probably do is set you up with a referral to get a cranial nerve done very soon, just to make sure that the cranial nerves are completely healthy, but just to calm maybe any nerves that you have right now. Everything else has been perfectly fine, and the cranial nerve exam was only a slight misstep, so I think you'll probably check out great, but as your care provider, I just want to make sure that you are at the best possible position to be as healthy as possible. So I think a cranial nerve exam would be best. Speaking of that, I have this bottle of solution here. And what I want to do is I'm going to open the end and just kind of squirt some solution in your eyes just to kind of calm those cranial nerves until your appointment, okay? Yeah, so I'm just going to open this up. And then if you want to hold still, I'm just going to squirt this in your eyes here real quick, okay? You're doing great. Almost done. You're doing great. Just hold still. Okay. Okay, great. That concludes our exam today. You did a great job, but as mentioned prior, I just want to follow up with your cranial nerves, okay? So maybe on your way out, talk to admin, and we will get you a referral to a cranial nerve exam, which you will have very soon, okay? Okay, great. Well, it was a pleasure working with you today, and I hope you have a lovely, lovely week. I'll see you soon.